We start with the breaking news that within the last few minutes, the NHS has released the first data this year about how the health service is coping in the winter. There's been a 350% increase in flu cases, an 86% rise in norovirus cases, and an average of 1,099 people in hospital with flu every day last week compared to 243 in the same week last year. Our health correspondent Ashish Joshi joins us now to help break down these numbers, Ashish, that seem incredible on the face of it.
Yeah, there has been a build-up in the number of cases we've seen, and I think, Wilf, the problem this time round is that flu season seems to have come earlier than it did last season. So we're having this situation now in hospitals where there are some very sick people with flu, RSV, norovirus, and some with COVID as well. It's been called a quademic. And this is putting a lot of pressure on services, on hospital beds, fewer hospital beds available than they were at this time last year. Certainly ambulance handovers, they've been impacted as well. They've been delayed. If you compare them to the figures for last year as well, these are the first set of winter sit-rep reports. So this is what's happening in hospitals over the winter. And this is really important because we'll hear the Prime Minister talking about the NHS and his targets for bringing down this elective waiting list. But there's been a warning in the last week from health leaders saying it's all very well for the Prime Minister to talk about his elective recovery plan. But what that's going to do is that's going to put pressure on other parts of the system, especially places like ED. There is no slack in the system. I've been in about 3 or 4 hospitals this week, and they just look so much busier than they did at the same time last year. The waiting rooms in ED, if you've been unfortunate enough to have to go to an emergency department, you'll know exactly what I'm talking about. The wait times are going to get longer and longer because the demand on services is just growing all the time, and that's because people are sicker, the populations have grown, and also because there is pressure within staffing in the NHS. So lots to go out for the Prime Minister when he talks about his vision for the NHS today. This is an interview we did with the London Ambulance Service talking about the pressure they're seeing on their services.
So it's been incredibly busy over the last couple of months. We've seen probably somewhere close to 10% more activity, and by that I mean 999 calls coming into our system than we did for the same period last year. So we know winter's always busy, but actually it started a little bit early this year and increased in that demand.
And the key words there, it's the increase in demand, and winter seems to have come a little bit early. But I have to stress, Wolf, that we talk about the winter crisis, but there is not really a clear breakdown between the seasons for the NHS anymore. It seems just to go from season to season under a great deal of pressure. But certainly all the indicators, according to this first sit-rep report, are pretty stark when you look at the patients with flu in hospital already and the pressure on beds and ambulance handover times.
Ashish, as always, thanks so much.